I'm Dr. Rob Hicks. I'm a GP working here at the Randolph Surgery in London. The usual symptoms of tonsillitis are a very painful throat and often a high fever. Some people get a headache, ear pain, a cough, and it's often really difficult to swallow anything at all, food or liquid. Now, when somebody sees their doctor, the doctor will ask them about their symptoms. They'll want to examine their neck for enlarged glands. They'll want to look in the back of their throat to see if the tonsils are red and swollen and inflamed. And often the tonsils are covered in white pussy spots, which helps form the diagnosis that what they've got is tonsillitis. Those who are at most risk of developing tonsillitis are children and young teenagers. The reason behind this is their immune systems are developing. Plus, of course, they're often exposed to many different infections. As we get older, the role of the tonsils diminishes, and so we're less likely to develop tonsillitis. It's much less common for somebody to have their tonsils removed, called a tonsillectomy. The reason behind this is that the research would suggest that actually there's very little to be gained in somebody having their tonsils removed. Although initially, after the tonsils are removed, a person may suffer fewer throat infections in the first 2 years, after that they're likely to suffer the same number of throat infections as somebody who hasn't had their tonsils removed. Add into that equation the fact that it's an operation, so with any operation comes inherent risks, the risk of a general anaesthetic, the risks of pain and infection afterwards. And notably with a tonsillectomy, there's a risk of bleeding afterwards, which is why nowadays, where possible, surgery is not performed or recommended, because in time, people will grow out of this condition. If your child is suffering with tonsillitis, then of course tender loving care is very, very important. You can bring down a high temperature and relieve the pain of a sore throat with the appropriate dosage of children's paracetamol or ibuprofen. Remember never to give aspirin to children under the age of 16. Of course, offer them plenty of liquid to drink, offer them food that they can tolerate, and if you're worried about your child or if their symptoms don't appear to be getting better as they should do, then never hesitate to seek medical advice.